Good morning to everyone. This topic is, I'm starting with the topic, effectiveness of scapular PNF stretching and self-stretching in subjects with adhesive capsulitis, a comparative study. Aim of the study was, the purpose of the study is to know effectiveness of scapular PNF stretching and self-stretching in subjects with adhesive capsulitis. Hypothesis, null hypothesis was, there is no significant difference in effectiveness of scapular PNF stretching in comparison with control group on reducing pain and disability in subjects with adhesive capsulitis. Alternative hypothesis, there is significant difference in effectiveness of scapular PNF stretching in comparison with control group on reducing pain and disability in subjects with adhesive capsulitis. Design of the study, experimental study design. Study setting, Sri Venkateshwara Ramanarayana Ruya Government General Hospital, SVRR GGH Tirupati, WIMS Physiotherapy OPD, Narsingapuram Tirupati. Study duration, 4 times a week up to 4 weeks. Sample size, 30 subjects are taken and divided into 15 in each group. Selection criteria, inclusion criteria, symptomatic subjects between the age group of 40 to 60, both male and female, subjects having stiff and painful shoulder for more than 1 month, minimum 50% of restriction in abduction and external rotation of shoulder joint, and unilateral involvement and stage 2 adhesive capsulitis. Exclusion criteria, history of recent shoulder trauma in and around shoulder joint. Next was history of shoulder surgery, neurological deficits affecting shoulder functioning during daily activities, and pain of disorders of the cervical spine, elbow, wrist or hand, other pathological conditions involving the shoulder like rotator cuff tear, tendinitis, etc. Intervention, 30 subjects with shoulder pain were selected for study and randomly divided into 2 groups. Group A, that is 15 members, scapular PNF stretching. Group B, 15 members, that is self-stretching. Outcome measures are visual analog scale and SPADI, shoulder pain and disability index. Data analysis, pre and post test analysis of SPADI in experimental in group A, paired t-test results, p-value and statistical significance is, the two-tailed p-value is less than 0.0001. By conventional criteria, the difference is considered to be statistically significant. Confidence interval, the mean of pre-test minus post-test equals 68.33. 95% confidence interval of this difference was from 64.59 to 72.08. This is the group A versus 7A scale, the mean and SD pre-test and post-test results. This is the graph recording in progress, pre-test and post-test. The pre-test was 7.53 and the post-test was 4.53. Next was pre and post-test analysis of visual analog scale in control group B. P-value and statistical significance. The two-tailed p-value is less than 0.0001. By conventional criteria, this difference is considered to be statistically significant. Next, confidence interval. The mean of pre-test minus post-test equals 1.53. 95% confidence interval of this difference is from 1.25 to 1.82. Intermediate values used in calculations are t-value is 11.500 and differential was 14. Standard error of difference was 0.133. This is the group B visual analog scale and as 6.73 and 5.20. These are the mean values, pre-test and post-test values. And this is the recording progress of graph of group B visual analog scale. These are the pre-test and post-test results. The pre-test was 6.73 and the post-test was 5.2. Next was the post-test analysis of visual analog scale in between group A and B. P-value and statistical significance, the unpaired t-test results. the two-tailed p-value equals 0.1478. By conventional criteria, this difference is considered to be not significantly significant. Confidence interval is the mean of post-test A minus post-test B equals 0.67. 95% confidence interval of this difference was from 1.58 to 0.25. That is, sorry, 1.58 to 0.25. Intermediate values used in calculations are t value is 1.4884 and differential was 28. Standard error of difference is 0.448. This is the groups post-test A and post-test B, the mean values and the objected results. This is the recording in progress of graph. Pre and post-test analysis of SPARI in experimental group A. P-value and statistical significance. The two-tailed p-value is less than 0.001. By conventional criteria, the difference is considered to be statistically significant. The confidence interval is the mean of pre-test minus post-test equals 68.33. 95% confidence interval of this difference is from 64.59 and 72.08. Intermediate values used in calculations are the t value is 39.1632 and the differential df was 114. Standard error of difference is 1.745. This is the pre-test and post-test values, mean, SD and N. This is the graph of group A SPADI, pre-test and post-test values. The pre-test updates 0.109.2 and the post-test was 40.87. Pre and post-test analysis of SPADI in control group B. P-value and significance. The two-tailed p-value is less than 0.0001. By conventional criteria, this difference is considered to be statistically significant. Confidence interval, the mean pre-test minus post-test equals 46.07. 95% confidence interval of this difference was from 38.21 to 53.92. And the intermediate values used in calculations are T 12.5734 and differential was 14. Standard error of difference is 3.664. This is a group of groups mean of pre-test and post-test values. And this is the group B SPADI graph value. Pre-test was available 108.47 and post 62.4. Post-test analysis of SPADI in between group A and B. P-value and statistical significance. The two-tailed p-value is less than 0.001. By conventional criteria, this difference is considered to be statistically significant. Confidence interval, the mean of post-test A minus post-test B equals minus 21.80. 95% confidence interval of this difference is from minus 29.33 to minus 14.27. This is groups post-test A and post-test B and these mean values. Intermediate values used in calculations are T is 5.9310 and DF was 28. Standard error of difference 3.696. This is the recording of group A and B in SPADI. Group A obtains 40.87 and group B 62.87. The graph showing the results. Okay, the results was the pre and post test values of the groups were analyzed using paired t-tests and independent test. The visual analog scale and SPADI percentage across baseline, second week and fourth week follow-up showed a significant improvement statistically in their mean scores within group A and B. Statistical significant greater changes in score were found in PNR stretching as compared to self-stretching techniques. Yeah, thank you.